Hello and welcome to today's video. My name is Sarah from Lotus Petal Family Support and this is Laura from The Butterfly Mother. Please subscribe to our channel for more videos on parenting and mental health.
This is day 2 of the UK Maternal Mental Health Awareness Week, and in aid of today's topic we're going to be talking about the best ways that our healthcare professionals can support families who are going through a perinatal mental illness. Sarah and I have both had quite mixed experiences when it comes to interactions with healthcare professionals, and we just want to share from a patient's point of view the best things and the worst things that a healthcare professional can do. First of all, I thought it would be quite a good idea for us to share our own experiences. So Sarah, do you want to let us know how it was when you went to the doctors?
Overall, most of my experience with healthcare professionals has been very good. I've had lots of compassion and lots of support from my healthcare professionals. However, I suppose my main complaint, of an experience that I had was a doctor telling me that I didn't look like I had depression. This was when I had my third baby, so I very much knew what I was going through and I knew that it was the start of postnatal depression again. And I went into my appointment with my hair and makeup done. I looked quite smart because it was a family event that day, and when I explained what I was going through and the doctor was reading through the facts that the perinatal mental health team had sent her, she said that I didn't look like I was struggling. I suppose for me it just made me feel like a fraud, that I didn't look ill enough and I was supposed to look a certain way. So I suppose for me that was sort of my main gripe, that I was being judged on how I presented myself when really I was trying really hard to look well.
I think that's quite similar as well if we're talking about negative experiences. I had a similar negative experience with a doctor who, they didn't say I didn't look ill enough, but she said, what have you got to, it's sunny outside, you've got a beautiful new baby, what have you got to be sad about? And obviously that was already my biggest fear. I was already so upset by the fact that I didn't feel happy and I hadn't felt bonded with my son, etc. So for her to say that, she might as well just punch me in the stomach. So I think, yeah, the initial reaction from a doctor can be quite, can make a big difference.
Yeah, definitely.
And then what was good?
Good. Well, when I had my second baby, I went into our 6-week check and I found the doctor and the nurse were incredible. They took what I said really seriously, and also I kind of felt like there was it was not too much trouble. Like nothing they did was too much trouble. They sorted out my medication, they sorted out my therapy for me, they got me in to see the psychologist that day. So for me, I felt like they were taking it really seriously, and that it was like the first time I was being heard.
Yeah, they were listening.
Yeah, they were listening to me, and they could see how much it was impacting me and my life. So that for me made me feel like, oh God, I'm not just. I think sometimes you worry you're making something out of nothing. Am I being dramatic? Am I feeling more than what I am? But it just validated that it was real.
It's hard enough to get up the guts to go to the doctor anyway. Yeah, so totally. That's why healthcare professionals have to be so careful, because it might have taken so much for that woman to get in the doctor's surgery in the first place. So it's so important. I think good things for me, for both of us really, is that we were really fortunate that we live in an area that has a specialist perinatal mental health service, and they were actually able to help both Sarah and I way before we ever met, but we were both able to take advantage of that. So yeah, that was definitely a good experience for me, and my health visitor as well was a really good professional for me. She instantly referred me to that perinatal mental health service, and she was a good support throughout, even though she didn't have loads of knowledge about postnatal depression, postnatal anxiety. She was still sympathetic, which is all you really want, is a sympathetic ear, someone to listen to you, understand you, and help you to take action for your recovery. So with that in mind, we thought we would share our top tips for best practice for any healthcare providers who might be watching. What we would love to see from you, basically.
Okay, so our first top tip is to really listen to what that parent is saying to you, and also really important to make eye contact. So many times I would go into an appointment and the doctor would be sitting typing on their keyboard and they wouldn't even look at me. And also the same for health visitors. My first appointment with a health visitor, I filled out my questionnaire, the Edinburgh score, and I lied on my form, ticked everything I thought I should write. And I remember thinking to myself, please look at me and look me in the eye and realise that I'm not really telling the truth.
Yeah,
I wanted
see
her
me.
to talk to me, see me.
Yeah.
So that's really important. I think just taking that moment to stop and really listen, look at the parent. Sometimes body language can also give away so much. Just take that time to listen to them can make a world of difference.
Our second tip, if you like, would be to do your research. Obviously, GPs especially are general practitioners, so they have to be aware of a whole massive spectrum of different illnesses. But with mental health, it's really important to do a little bit of research, make sure that you understand the sort of symptoms to look out for, and like Sarah says, the signs of someone who might not be being honest on their questionnaire. So yeah, do your research, and if you feel like you don't know enough, then reach out. We know from our local area that there is a specific psychiatrist who is willing to be a phone call away from any GP, you know, if they've got a specific question. So that's what we would love to see more of. And do your research about meds as well. Medication is so important, and getting the right medication and knowing how long someone should be on the medication for, etc., is like really, really important.
Following on from Laura's point, please be aware of what services are local to you and also what local peer support groups you have. All of these can be a huge benefit to that parent.
And lastly, just be as supportive and understanding as you can be. Like we've expressed, we've both had some negative experiences, and we know lots of other survivors who have had similar negative experiences. So just be supportive, listen, take the time if possible. I mean, I know all GPs are overstretched, but if you can take that time to really listen and try to read between the lines, and support that person better.
Next, we're going to share with you some things that are best avoided, as they can cause some patients distress.
I think a really key point, and something that definitely comes under research, is confusing OCD symptoms, and in particular intrusive distressing thoughts that might be shared with you from the patient, confusing those with psychosis. So Sarah and I, and lots of other people we know, experienced OCD in the form of intrusive thoughts, where we would have thoughts about harm coming to ourselves or our children, and obviously that's something that's really, really difficult for anyone to disclose. So if you've got someone in your surgery who has disclosed that information, then please just make sure that you know what that is, and know that that can be a symptom of OCD, and not rush to think that that means that they are psychotic. Obviously we are not medical professionals, but as far as I understand, if you are distressed by that, and if you acknowledge that those thoughts are unusual, then it can't actually be psychosis.
Next, try to avoid belittling someone's feelings. So as I said earlier, a doctor once told me that I didn't look unwell and I didn't look like I had depression, and Laura was told that, you know, what have you got to be depressed about, it's sunny outside. Comments like that can be really hurtful. And
lastly, it's just a point about medication. Obviously, with the way that the country is in the NHS, there isn't always a lot of options, and a lot of signposting that healthcare professionals can give to patients. So quite often they will quickly rush to giving you a prescription for medication. One thing I would just say is to try not to rush to medication without exploring other options, and also without explanation. So for example, my GP gave me antidepressants, an anti-anxiety medication and a sleeping aid without really telling me anything about them, how much I should be taking them, what side effects to expect. It just felt, again, a little bit uncaring that they'd just given me this prescription and sent me on my way.
For anyone watching the video who thinks that they would like to approach their healthcare professional for some advice, we have a really great resource, which is a GP checklist, which is actually created by the SMILE group. We will link that below so that you can download it and take it along with you to your GP appointment.
Also, the Royal College of GPs created a toolkit for healthcare professionals, which is full of fantastic resources all regarding this topic, so we will link that below as well. We'll be back tomorrow with another video in aid of Maternal Mental Health Awareness Week, so hopefully we will see you then.